Hello, ma'am. I'm the pharmacist here. My name is Li. Hi, how can I help you today?
Oh, I just picked up my medication. I don't know how to use them. Could you help me?
Yes, of course. So for privacy, I think we can sit this area.
Okay.
And what's your name?
Oh, Jennifer Rogers.
So Jennifer, I will have to take some time to go over the medication with you.
Okay.
Make sure you know what it's for and how to take it.
Okay.
Do you have about 10 minutes for that?
Pardon?
Do you have about 10 minutes for that?
Oh, yes, sure.
Thank you. So, are you taking any kind of over-the-counter medicine?
Oh, yes, I take the Centrum, and sometimes, occasionally, I take the over-counter allergy medicine. Yes.
Okay, so what other medical condition do you have?
It means other condition?
Right.
I'm pretty healthy, so, and I do not take any medicine, yeah. So only this time I coughing and keep coughing, and then had tightness of the chest, so yeah.
So, okay, so the doctor gives you these
Yes,
new medications?
yes.
So, do you smoke?
No, I don't.
And do you have any known drug allergy or food allergy, seasonal allergy?
Oh, no, not in my knowledge, yes.
Perfect. So there are two medicines
Yes.
in your new prescription.
Yes.
The first one is called Serotype 250 Evohaler.
Yes.
And it's the purple one.
Okay.
And the other one is called Barotype.
Okay.
And it's this blue one.
Okay.
So what did the doctor tell you these medications for?
Oh, just for my newest diagnostics, asthma.
Oh, so you only know it's for your asthma.
Yes.
Yes. So both of these inhaler are for your asthma,
Yes.
but they are for different situations.
Oh, sure.
Right. So
Okay.
I will go over this one first, then
Okay.
we'll go the other one.
Okay.
So this one is called Serotype 250 Evohaler, and this is a kind of long-term controller medication. So it helps to prevent. It's for prevention, prevents symptoms and asthma attack.
Okay.
And how did the doctor tell you to take this medicine?
No, he didn't.
Okay, so I'll let you know.
Okay.
So you take it 2 puffs at one time.
What's that mean, 2 posts?
2 puffs means, I'll show you later.
Okay.
And you take it twice a day.
Twice a day?
And
Okay. How long in between?
Yeah, 12 hours apart. So you
12
take
hours
it
apart?
7 a.m. and 7 p.m.
Okay.
like that. So I'm going to teach you how to use this inhaler.
Okay.
So for the first time, you have to remove this cover, and you can use it with or without these aero chamber. This is for, it helps to deliver the medicine. Okay, so you can use it with or without it. And for the first time you use it, you have to check if it's working.
Okay.
So you shake it.
Up and down?
Yeah, shake it for
Okay.
5 seconds. Then you press into the air.
Okay.
So you repeat these steps, and until you can see there's a counter on the back of this inhaler. So until it reaches 120. So 120 means you have 120 doses left.
Oh, okay.
Right. And so every time before you use this inhaler, you have to shake it for 5 seconds, then check if it's clean, and you can use it with or without it. And if you need this, you set up like this with the thin side in it. So you shake it, Then you hold it like this. You sit straight. Then you breathe out. You breathe out. Then you put this mouthpiece into your mouth between your teeth. Close your lips around it, but don't bite it. And as you breathe in, slowly and deeply, you press down to release a puff. So you have to take 2 puffs, remember? So you after you press the puff, you have to hold your breath for 10 seconds. Then you can breathe normally. And for the other puff, you have to wait for 30 seconds.
30 seconds? Okay.
Yeah. And remember to rinse your mouth with water and spit it out every time you take this medicine to reduce the risk of fungal infection in your mouth. It can really make you suffer, so make sure you rinse your mouth every time. What did the doctor tell you to expect?
Was good for.
This medication can really start working after 5 to 10 minutes, and it can last for at least 12 hours.
Okay.
And I will also want you to know some side effects. Some people might have headache, and some people might get throat infection. But don't stop taking this medication before you talk to your doctor.
Well, even if I feel better, I cannot stop it?
Yes.
Okay.
It's very important to prevent asthma.
Okay.
And I know it's a lot of information for you. Okay. And for this one, this is called Barotec, the blue one. And this is a quick relief medication. So you take it only when needed.
Okay.
And it helps when severe asthma attack. So when you have symptoms like chest tightness or wheezing, you should notice that you need Barotec. So in this severe case, Serotype won't help. It has to be Barotec. So when you need Barotec, you need 2 puffs at one time.
The same as that one?
Right, same.
Okay.
And if you still need more than 2 puffs, you have to wait for 5 minutes because
each pulse in between had to wait for 5 minutes?
No, in between just wait 30 seconds.
30 seconds?
But
okay.
after 2 puffs, if you still need more, you have to wait for 5 minutes.
Okay.
Because it takes 5 minutes for it to start really working.
Okay.
And the maximum doses for this is 8 puffs. So if you already take 8 puffs and you're still not getting better, you should go to the doctor right away.
Okay. Can I use them together?
Yes, I think. No, because you take this regularly every day, right? And in between, if you don't feel well, you have to use this one for severe asthma attack.
But after I use this, and I suddenly feel I'm very uncomfortable, I feel asthma is coming up, can I use this right away?
Yes, I think
okay.
you should use it.
Okay, sure.
Okay, so remember to get refilled before you run out of either of the medicine.
Okay.
And if these medicine really making you uncomfortable, you have to talk to the doctor before you reduce the dose or stop the dose.
Okay.
And
how do I clean it?
You have to keep it dry and away from heater, and don't drop it. But you can wash this one with water, and you clean these just with dry cloth or tissue.
Okay.
And do you mind teaching me back how to use these inhaler?
I need to open it,
right,
and shake it up about 10 times, and then pop it first, take it out, and then put it in between my mouth, and then pop up, sit upright, and inhale, and then spread it, and then breathe slowly, and then wait for the first pop, and wait for 5 seconds, and then have the second pop.
And remember to hold your breath after.
Hold my breath
yeah.
after. And after that, I need to wash my mouth.
Right.
Okay.
So, if it, you can share these information with your family or your friends so they can watch out for you as well.
Okay.
And there's a leaflet for you,
Okay.
so you can read it.
Mm-hmm.
And if you have any kind of question,
Mm-hmm.
don't hesitate to give me a call.
Okay, sure.
Okay, so do you have any other problem?
Not so far.
Okay,
Okay.
thank you.
Okay,
Thank you for your time,
Okay.
and I wish you the best.
Okay, thank you.
Thank you.